Hi everyone, welcome back. Today we're joined by Dr. Adam Balls, Chairman of the Emergency Department at Intermountain Medical Center, to talk about how our emergency departments are safe and you're allowed to receive care there right now. Adam, thank you so much for joining us. We really appreciate it.
Great, thanks Amanda. Thanks for having me on.
So I think that this entire topic came up because of things that we've been seeing in the news about people delaying going to get care in the emergency department or being worried about going to the emergency department. Should I be worried about going to the emergency department right now for care?
Absolutely not. Across the country, there's a fear that if you're going to seek care at a hospital, emergency department, or an urgent care, that there's increased risk of contracting COVID-19. And we want the public to understand that we are doing all that's possible to minimize that risk and make it as low as possible, and that it's still safe to seek emergency care in the same way that you did before the COVID-19 pandemic began.
And what are some ways that we are taking extra precautions to make sure that the emergency department is safe even before you get there? What are our caregivers and leadership team doing to ensure that?
So across each of the hospitals throughout Intermountain Healthcare, we've implemented screeners at all of our buildings and any entry point onto our campus. So if you're trying to get into one of our buildings, even if you're a staff member and an employee, you'll go through a series of screening questions. Do you have fever? Do you have cough? Do you have shortness of breath? If you do, then we'll not be allowing you into our buildings, because if you potentially have COVID-19 symptoms, we don't want that spreading within our hospitals. That exists at each of the buildings on campus, and then separately in the emergency department, we also have a greeter nurse that will interact with you and be asking you those same questions to every person that checks in. Are you here for fever, cough, and shortness of breath? And the reason that we're doing that is to identify respiratory symptoms, potential COVID-19 symptoms, but also to separate patients that may potentially have COVID-19 from patients that don't have those type of complaints in different areas of our emergency departments.
So if I feel like I need to go to the emergency department, what are some steps that I should take before I even get there? Who should come with me, if anyone, and what should I expect when I get there as far as care goes?
So if you have an emergency that requires you to call 911, such as a stroke, a heart attack, shortness of breath, severe weakness, or certain types of traumatic injuries, we would want you to access the 911 system, where our first responders are also trained in the same type of protocols in terms of identifying COVID-19 risk. If you are being brought to the hospital by a family member or a friend, we are limiting visitors at our emergency departments. We aren't allowing visitors, so we'll be getting cell phone numbers from your family member or friend that you want us to contact. A lot of communication now is happening through the cell phone. We are beginning to use iPads and video interfaces to communicate with family members and friends through our iPads within the emergency department and through FaceTime type technology. So there will be a separation of patient from visitor. Pediatric patients are still allowed to have a parent there. People with special care needs are also allowed to have a caregiver present with them. If you come to the hospital as a patient, you're going to have a mask put on you. We're beginning to put masks on all of our patients. If you don't have one, when you come to our emergency department, we'll provide one for you for the duration of your visit in the emergency department.
I think it's also important to know that these questions and masking people when they come in is not only to protect them, but also our community and caregivers. You mentioned separating people who are having respiratory issues from other people. And is that to hopefully stop the spread a little bit more, or what was the reasoning behind those two separations?
So we early on began to realize that we needed to cohort or separate COVID-19 patients from other patients. So within the emergency department here at Intermountain Medical Center, our new front end space that was completed and the construction that finished in the beginning of January now became our respiratory unit. And in that unit, our caregivers will wear special type of personal protective equipment, personal respirator devices. We'll have access to gowns, gloves, and the things that we need to care for respiratory patients. And that is separated and in one part of our emergency department. The staff will also have different personal protective equipment for non-COVID-19 patients. So it's not only to protect our staff, but it's also to reduce the risk of transmitting potential COVID symptoms if we don't separate those patients appropriately.
I've also heard stories of surgeons or care teams coming out into the parking lot too to tell people, give them updates about what's going on. If you are going to the emergency room and you say, for instance, can't drive yourself, but it's not a 911 emergency, should that person stick around just in case they're needed, or what are your recommendations for that?
We do ask those patients and caregivers to stick around if they can. A lot of people were getting cell phone numbers and then they're choosing to wait in their car, listen to the radio, answer our calls from the hospital when they come in. So we are requesting that patients and visitors, the visitors stick around until that emergency department visit is kind of nearing completion. And we kind of know if your family member is going to need to be admitted to the hospital, we can provide that update to you. And we're allowing you to stick around during that time that your family member's in the ER.
That's good to know. It's a good alternative to being in the hospital, and it probably keeps that person accompanying them safer as well because they're not exposing themselves to a risk. Before the Facebook Live started, we were talking about the delay in care and what could happen if you were not seeking care. For instance, if you have a stroke and you decide that you don't need to go in because you're nervous about going in, can you speak a little bit about why that's so important to not delay care?
Yeah, there are certain types of disease processes and illnesses that are time sensitive, meaning that we in the emergency department and the specialists can offer you particular treatments if we catch your disease process early on in its course. For instance, stroke, we have about a 3 to 4 hour window where we can give you a clot busting medication through an IV to treat that acute stroke, but we need to catch you within the 3 to 4 hours of the time that your symptoms start. Similar with heart attacks, there's time is muscle when it comes to the heart muscle. So if you delay seeking care and are having a heart attack, then your heart muscle will weaken and may end up in heart failure. If you're having severe abdominal pain, we don't want your appendix to rupture and then lead to further hospitalization and more expensive care because you didn't seek care appropriately and within that first few hours of your symptoms beginning.
What about something like an injury you get from being outside? Say you're going mountain biking and you think you broke a wrist. I know someone who potentially thinks that they broke their wrist and they aren't sure if they should go get care. Is there a way for them to check before they go to the emergency room if they do have an injury that needs to get addressed now? Do virtual visits help that, or is that something where if you hurt yourself and you think you did something, you should still come in?
Yeah, certain types of sprains and minor type injuries, our Connect Care app is still available, and we're wanting the community to use those resources appropriately. If you think you don't have an emergency that requires the emergency department level care, our Instacares are still open and willing to see you. They're also implementing similar processes to make you safe as a patient that would be seeking care. So again, I go back to back at the end of 2019, early on in 2020. If you felt like your visit required emergency department care or urgent care, please seek the care that you feel that you need in the same venue that you did previously. But yes, our Connect Care and virtual visit technologies are still available, and we can route you to the appropriate place after that initial Connect Care visit.
A quick question too about entrances at our hospitals, and this isn't just the emergency department, but are there separate entrances for different types of care that people are seeking specifically at Intermountain Medical Center, or is everyone getting filtered through the emergency department when they're coming in?
We have kind of a direct admission process for patients that are seen at other care venues that are going to be admitted to the hospital. But really for emergency department patients and for patients seeking care in our hospital right now, that will really filter through the emergency department. As we begin to have elective surgeries start back up, we'll begin to open up other entrances to the hospital where people will be coming for their same-day elective surgery procedures. So for right now, most of those patients are coming and seeking care in our emergency department entrance.
So if I am sick and I do require care, what is the best way for me to start that process to actually receive the care that I need?
So the best way for you to receive that care would, again, if you have the Connect Care app on your phone, accessing that app. If you want to call your doctor and get recommendations on should you come to the emergency department, I would recommend doing that if you feel that that's appropriate and you can get a hold of your physician. A lot of the clinics now have the telemedicine technology visits available where they can do an initial assessment and then refer you to the emergency department. But we don't want you to, again, to delay care or take too much time going through that screening process through those technology apps if you need emergency care right away.
Is there anything else that you kind of want to let people know about the emergency department to reassure them that it's safe to be here and we're open and we want you to come in if you need care?
Yeah, all the processes, the way that we treat trauma and stroke patients and heart attack patients, all those processes are the same. So I want to reassure the public that even though we are treating COVID-19 patients in separate areas and in a different way than we treat other illnesses, the care that you receive for non-COVID-19 illnesses is going to be the same expert level care. Our staff, resources, nurses, and techs are still available. We are still appropriately staffed to be able to deal with any and all emergencies when they do arise.
I think that's really important to remember, that a COVID-19 emergency or non-COVID-19 emergency is still an emergency, and that you should access the care you need so you don't further hurt your health down the road. So Adam, we really appreciate you joining us today. Thank you so much for all the advice. And if you guys are experiencing a life-threatening condition and would like to get care or need care, please call 911 or come to our emergency department. As we mentioned, they are safe and we're open to help you get the care that you need. If you're experiencing mild to moderate symptoms of COVID-19 and would like to be screened, you can call our COVID-19 hotline at 844-442-5224. Thanks, everyone. We'll talk to you next time.